My name is David Attarian. I am an orthopedic surgeon who's been on faculty now since 1999. And the bulk of my practice is adult reconstruction, which means I replace people's hips and knee joints. I think we are different than most joint replacement centers in that we really focus on all three missions of an academic center. So we provide the best possible clinical care, and we do that in a setting of education. So we're training medical students and residents who are always among the best at Duke, and so they're constantly sort of testing us to be sure we really know what we're saying. And then we're doing cutting edge research as well to bring the best possible technology to our patients. And I think that blend ultimately produces value for the patient so that they have a very good experience and hopefully a very good outcome when they get their surgery at Duke. I think for us in joint replacement surgery, it's not the one patient, but it's the many patients who come in who are desperate because of their severe pain, either because they have a very arthritic joint or they had a bad injury or they've had a joint replacement done somewhere else which is infected. And their whole lifestyle has been crippled literally because of a hip joint or a knee joint that's gone bad. And more often than not, we can take those people and over a course of time and one or two operations, we can get them back to more often than not, a pain-free lifestyle, independent lifestyle. And that, at least in orthopedics, is probably one of the most rewarding things we do. We really improve their quality of life and their independence.